So I see the numbers of folks rolling on in. It's fabulous to see you all here this afternoon. Good afternoon and welcome to today's webinar, COVID-19 and Social Media, Best Practices to Reach Your Communities. The CDC Foundation Community COVID Coalition is so pleased to host this webinar in partnership with the Vaccine Equity Cooperative and Health Leads. This webinar is part of our ongoing commitment to support those of you who are working in communities and partnering with communities all across the United States. And again, we so appreciate all that you're doing to partner with us in this ongoing pandemic. I'm Julie Scofield, and I'm the moderator for this afternoon's webinar. Today's webinar is available in Spanish. To listen to this presentation in Spanish, click the globe interpretation icon at the bottom of your Zoom screen. We also have a closed captioning option. To enable closed captioning, again, click on the closed captioning icon at the bottom of the Zoom screen. So before we begin our conversation today, there are a few housekeeping items to review. Today's webinar is being recorded and it'll be sent to everyone who registered along with any materials that need to be shared. During our webinar, we'll have time to answer as many of your questions as possible. Please submit your questions using the Zoom Q&A button found at the bottom of your Zoom screen. You can also use the Zoom chat feature to share comments, reactions, and links with everyone who's participating. Last but not least, at the end of the webinar, we will be launching a poll and evaluation survey. So please stick around, take the time, and quickly share your feedback on today's webinar and suggestions for future offerings. By way of a little background, the Community COVID Coalition is a project of the CDC Foundation. Starting in June of 2020, our project focuses on behavior change communication, researching, message testing, and creating COVID-19 social media campaigns. Our current focus is on partnering with CBOs to reach the not yet vaccinated with messages designed to help move them along a continuum from vaccine hesitancy to vaccine acceptance. We know CBOs are critical partners in this work, and we're thrilled to bring this webinar to you this afternoon. During today's webinar, experts will address questions on effective social media communication strategies and share best practices for leveraging social media in your community, especially with limited resources and small budgets. We'll highlight two organizations implementing equity-centered approaches to ensure public health communications reach our most vulnerable populations, feature culturally competent content, and combat misinformation. Getting us started will be Dana Variano, who co-leads the digital team at Rally, which focuses on inspiring folks to act online, converting clicks into meaningful offline impact. Then we'll have two bright spot case studies. The first comes from Sabina Mohyuddin from Nashville, Tennessee. Sabina is the executive director of the American Muslim Advisory Council. AMAC empowers the Tennessee Muslim community through civic engagement, community building, and media relations. Wrapping up will be our next bright spot case study with Dr. Gilberto Lopez, who's associate professor at Arizona State University's School of Transborder Studies. Among many things, Gil is director of the COVID Latino campaign, which combines the arts with social and health sciences to create culturally tailored messages around COVID-19 for Latino communities. Following our speakers, we'll open up for questions and do our best to answer as many as possible. And on that note, I'm going to turn it over to Dana to get us started.
Great. Thanks so much, Julie. And hey, everyone. Great to be here with you all today virtually. I'm Dana, as Julie mentioned, a digital account manager at Rally, an issue-based communications firm, works with health leads on earned and digital strategy and execution. I'm really excited to jump in and talk to you about social media and community organizing today. If you'll jump to the next slide, we have a lot to cover in 15 minutes. So these slides have a lot of text on them. We're designed to be sort of useful as a take-home guide. So feel free to, sit back, listen, and the guide will be sent to you afterwards. So just a little bit about myself to put today's information into some context. I have a background in nonprofit communications work and video storytelling. I started down this path before Twitter was a thing. So I've seen sort of the Vines turn to the TikToks and the Friendsters turn into Meta. But I've also seen what remains the same with the strategy, the tactics that when it comes to sort of community organizing on digital channels. Served as a comms team of one, often for many a nonprofit from New York to Los Angeles to New Delhi, focusing on issues like intimate partner violence, human rights, mobility justice. So I'm really excited to be talking to you from that point of view of how can we use the social media, often with folks who are only staffed on small teams or teams of one, to have effective community organizing strategies on social media. I've been at Rally for 2+ years, where we're an issue-based communications firm that works on all aspects of communications, from earned media, digital strategy, strategic frameworks to campaign execution, and of course, social media strategy and execution. But what do I really do? I mean, what do all of us communications folks working in advocacy really do? We tell stories, we build communities. So the next slide, you'll see sort of our goal of using these platforms is to amplify the stories of our communities, put the mic in their hand, right? And how do we build a base? That's the ultimate question we're trying to answer here. How do we build a base, create awareness around an issue, and bring people to action online and offline to create change? On the next slide, you'll see an image of sort of a networked concept of organizing. So how do we build these nodes, right? How do we get these folks who are sort of organizers in the center who will take leadership and action, orient and educate and mobilize others? We're going to talk about one way, which is the engagement ladder. So the engagement ladder or path is a common structure to think of community organizing. There are others like the sales funnel, but we're going to focus on this one. The main idea is that users start at the bottom of the ladder in awareness, where they first hear or learn about your organization, your project. As they become more and more engaged, educated, have more information about the issue, they're more willing to take larger actions, move up the ladder of engagement towards these higher steps: co-creation, volunteerism, donation. And the main concept you'll see on the next slide is to give folks sort of the right information or the right ask at the right time to sort of prime folks to move up the ladder. And of course, we can have many ladders. They can intersect, they can do crazy 3-dimensional, 4-dimensional ladder things. But we want to make sure that we're talking to the right folks at the right time. So most people start at level 1, awareness, right? Hearing about your organization, your issue, something that you bring up on a Facebook ad, something that you've tweeted out, that your partner has retweeted, reading about the organization in the newsletter, right? We consider this the level 1 of eyeballs. And as time goes on, right, we want to give them actions, education, information that's going to inspire them to say, okay, I'm into this. I want to help more. They want to move up to these higher rungs, right? Signing up and following, taking an action, then becoming a leader. So digging into the next slide, we'll talk a little bit about what these actions are. We usually think of them in 2 groups: awareness and engagement. So awareness is sort of learning and discovering about the topic, education around COVID and the vaccine toolkits, FAQs, that sort of thing. While engagement is taking action around it, right? Actually getting folks out, getting them vaccinated. In addition, getting policies passed, signing petitions, advocating, etc. Usually we start with awareness and lead into engagement as folks go up the ladder, but often both are happening at the same time. So now that we've talked about strategy a bit, we're going to jump in and talk about the 4 primary channels that nonprofits, foundations, organizers use to connect with communities. And keep in mind before we start that you don't need to, nor should you be on all the channels that we talk about today. It's really important to match your investment in the channels you're on with the time you have to make sure you're spending the effort creating content for places where your audience, your base, your demographic already is, and not taking on more than your team, which might be you and you alone can handle or juggle on a daily, weekly basis. And so jumping into the first one, Facebook. Want to note that Facebook is the most used social channel, has been for a long time. Note that my recommendations on this channel should be taken with a grain of salt because Facebook is conducting pretty large updates as we speak. But overall, great. Facebook is really strong for sending users to a specific landing page or action. Download this tool kit, click here to dig into these COVID vaccine facts. Video also performs really well on Facebook, as do images, but video is always a top performer of organic. It's also a really strong platform for private and public groups and information sharing. That said, it's active community management is really needed for Facebook. People are going to be leaving comments on Facebook organically or paid ads that will need to be addressed. So want to keep in mind if you do have a Facebook page or group to have that time. And keep in mind here, we do have cadence recommendations throughout, but for all channels, the most important thing is to be able to be consistent. Again, keep a rhythm that you feel is sustainable. Better to do sort of one post a week reliably than sort of 4 1 week, silence for a month, and then 4 again. Let your audience know what they can expect. A lot more to dig in after you get these slides. You can sort of use this as a guide for best practices and some tips for channels. But next, we'll jump into Instagram, owned by Meta and Facebook. Instagram, the content is sort of less based on click-throughs to specific URLs, but really great for education. Obviously, it's a very visual platform with images and video leading the way. But I've also bet that you've all seen sort of these PowerPoint styled, really fact heavy info sheets making their rounds on the Instagram platform. Really strong spot for education and sort of using hashtags that can really drive your content way further than your organic audience is a really strong platform for education. On to Twitter. Twitter is really about more than the past two, is really focused on engagement. It's about starting a conversation. It's the least of the broadcast platforms. It's got a really passionate user base that's loyal to the platform. I know if you're a Twitter user, you know you're probably on it throughout the day. You get your news on Twitter. You have really strong relationships on Twitter that you don't sort of have necessarily built through other channels. And like Reddit, it's sort of a really great place for niche conversations with specific audiences, including many issue advocates in the public health space. So the note here is that, you know, it's really worth engaging in if you're going to have the time to be on it a lot and engage. Great, but make sure that you're having two-way conversations and not using it only as a broadcast. Next, we'll talk about LinkedIn. LinkedIn is a great platform for organic and paid. We have content that's sort of more geared towards thought leadership and folks who are sort of more focused on a specific issue, like on Twitter. So it's really great. And like Twitter, users can actually follow specific hashtags, COVID vaccine, for example, on Health Lead on LinkedIn, for example. And then if they weren't even following Health Lead's LinkedIn page, but were following that hashtag and Health Leads use that, it would be linking that information going right to their inbox. So there's some really strong options for LinkedIn for brands, both organically and paid. And speaking of paid, we've talked a lot about organic channels really quickly, I know. And sorry, TikTok, we'll get to you next time. But organic can only go so far due to the algorithms in place. Right, overall, these are pay to play channels. So generally, if you are investing a lot of time in one of these channels, we really want to think about putting a paid budget strategy in place behind channels, even if it's a small amount, to access the entire or a wider percentage of your organic followers, and B, sort of increase this base by finding new followers. And there's really easy and great ways to do this. So we have some tips here about, installing pixels. It'll take 5 minutes, and then you can set up your Facebook ads to target people who come to your website and do lookalike audiences and things like that. We're going to jump now that we've talked through some channel info to sort of the depth of it all. What do we actually write and what do we actually show visually, and talk about some quick tips for choosing and writing content. So we all know there's such competition for folks' time. We all have such a small window to capture attention, specifically online. I think it's, a number of seconds before somebody moves on. The first 3 words of your subject of your email are all you usually get. So we need to ensure that we're doing the most with our language, that we do interest the eyeballs we do get, and don't sort of make people, lose interest and scroll somewhere else. So the main point we want to make in our copywriting is to give folks clear information in a way they can understand it, right? Break it down, take out the jargon, put it into simplified concepts, 1 sentence each, put it into plain language like you're explaining things to a friend who has sort of never heard the context. And we like to think of it as, I think a lot of us were sad when Twitter upped its limits to 280 characters, right? I think we like to think of 140 still as the limit, right? I think short and the quicker you can capture the attention, the better. Another rule of thumb I like to follow is to usually keep it to 1 call to action per thing you're putting out, right? Whether it's an email or a Facebook post, to make sure you're not sort of competing with yourself, confusing folks and asking them to do too many things at once. And then finally, just, after you write copy, just looking back at it, reading it, and, putting yourself in the shoes of yourself as a user of a lot of these platforms. How do I engage with this social channel? What content do I enjoy on this platform? Would I click on this? Those kind of things. The flip side of copywriting that we always think about is images and videos. Of course, it's always great to use your own organization photos, partner photos, volunteer photos. Sometimes those are hard to access. When we can't access those, we really want to look for Creative Commons images or stock photo sites that showcase people from all parts of the community and that we also have permission to use. We will be sharing a resource sheet after this with a number of links to some really great photo sites that we use regularly and recommend, some of which are free. And just really want to make sure that, an image is usually the first person that somebody's reacting to. We all know the adage of how many words it's worth. We want to make sure that the visuals resonate with the community rather than instantly put folks off. They include all parts of your community. Using poor, inaccurate imagery can make people feel alienated or excluded. We want to really be choosy here, and make sure we're putting as much time into picking images as we are into writing the copy. So the next thing we want to talk about, we've talked a lot about what to say and post on social, but as I mentioned with Twitter, the other very important flip side is how to engage with the community on social, because it's in the name. Social media is social. If we're not using it to have conversations, build connections, we're sort of missing out on a key benefit of investing time into online organizing. So first, we want to most importantly remember that this is your space. This is your community space. And you want your base to feel comfortable posting and being here. So it's up to you to coordinate and sort of be a referee for that space. So the next slide, you'll see we have some tips. Always delete misinformation. We realize not all orgs can, government agencies, for example, but getting rid of things like hate speech and hiding comments that spread incorrect information is important. Setting clear rules for engagement is a really strong way to do that. And then following them, right? Making a public guideline list and then sharing it publicly on Facebook so that folks know of the rules and know of the repercussions, and that the comment moderation team sort of has clear guides to follow. Setting pacing you can keep. Don't try to respond to everything, right? The comment guide can help you sort of prioritize responses so that you're sort of prioritizing answering questions that are legitimate and, ignoring giving space and time to ones that are not. Finally, I think this is a great place to, again, as with all copy, keep responses short, but it's a great place to link out to detailed information that you have. You don't need to sort of say it all in the comment response. As you can see in this example here, just, a short, succinct answer and then a link out is really helpful. On the next slide, you'll see an example of community guidelines we developed for one organization that was having issues receiving a ton of negative comments. So we made sort of really clear rules of engagement, clear, public, and now the team knows on a daily and monthly basis which comments to hide, which users to ban, and which to reply to. Okay, so finally, I want to touch on how to work with partners and influencers on social media. So may not always think of them this way, but we have plenty of folks in our community who already qualify as influencers. They don't need to be thought of as TikTok stars or people that you need to pay, $1,000 royalty packages to. But, thinking about create a partnership program with these folks and setting up a structure to highlight people and share their stories on your platform. Of course, we want to be mindful of compensating people for their time and their effort and creating ethical partnerships. And once we do that, we can use it to develop videos, photos, and quote highlights that we can sort of use on social, but also email, newsletters, funding applications, and things like that. There's a lot of power in the community and those stories, and we want to make sure that we're uplifting them using these channels that we have. So I know that was a whirlwind of information and not very much time, but I'd just like to say thank you so much for joining today, and really excited to hear from Sabina and Gilberto.
Thank you so much, Dana. That was really awesome. I love the ladder. I love the conversation about awareness to engagement. I think you've given a lot for folks to think about as they're going forward. I just want to quickly remind folks that we are going to share the recording out with all the registrants for today's webinar, along with the slides. So you'll have this information and perhaps some other resources as well. So have no fear about that. And on that note, I am going to turn it over to Sabina to talk about her organization and the way they're reaching the Muslim community in Tennessee.
Thank you, Julie, and thank you, Dana. That was a great presentation. I have a lot to learn from it myself. But so I'm here in Tennessee, and the American Muslim Advisory Council is a statewide organization working to empower the Muslim community. We do civic engagement work, community building, and also media relations. So really this kind of COVID response was not something I thought I'd find myself working on. But when we quickly realized that the community is made of a lot of different mosques, few organizations, and there was really no one to step up and take that lead with that education piece on COVID and how to stay safe, especially early in the days of the pandemic. And so we stepped into that role. We had to pivot, and we worked with mosques to create like a committee, physicians committee, to give recommendations to mosques how to stay, why they should stay closed and how to safely open when it was time. And we made sure that our newsletter always covered COVID-related issues and resources. And we were sharing on social media through Zoom, but always putting it on Facebook, also webinars on different resources, whether there's PPP loans or how to stay safe, what do you do if you have COVID, and things like that early in the pandemic. So what we realized, in understanding the Muslim community, you have to ask the question, where do people get their news? How do people keep up with what's going on around them? And we are a largely immigrant community. And you have to look at our community in terms of which generation you're looking at, the older generation or the children who grew up here. But I would say the older generation got their news from back home. So they were still following and keeping up with what's going on back home, whether it was on TV, through cable channels, or on social media. And so what you and I may have been watching on TV, if you were watching the evening news, was a pandemic that was spreading. People were anxious, but you saw the images of a lot of white Americans worried about the pandemic or getting sick or getting to the hospital. And you didn't, as a Muslim, you didn't see your own narrative there. You didn't see your own stories there. And so there was this disconnect. And then on top of that, people are following influencers or news agencies from back home. So there was, this disconnect of what's actually going on here, and is it connected with me, or what's going on back home. But we know in our community, Facebook is the #1 means of social media platform, the #1 social media platform, and it's not just Facebook, but I would say WhatsApp and Viber is also a very important way people share information and stay connected. And so thinking about on an equity level, we had to think of, well, how do we get this messaging around staying safe from COVID, or when the vaccine came out, how do we get this message to really resonate with the Muslim community? Because we recognize that the images that were being shown were images of other people, and so that you had that disconnect. Somehow this was a problem of, let's say, white Americans. This was a problem of maybe, that didn't have much relationship with me and my family and my reality. And then where was the information coming from? Again, it wasn't coming from people that looked like you, reflected your values. And so that was important to think of, like, who are people, the Muslim community, who do they listen to? Whose messaging is important to them? And those who are religious, well, is the easy answer. It is the clergy, the imams of the mosque leadership, where they go pray. But then also, because we're made of so many ethnic groups, sometimes it's the ethnic leaders in those communities. So really making sure that whatever message reflects, people see themselves reflected, and it's coming from a trusted source. So the religious leaders, the ethnic leaders, and that way people are more trusting of the information they're getting. And so it's interesting because a few months ago there was this effort in Nashville to share more social media posts around vaccinations, and you had all these community groups, and they really wanted to kind of address this health disparity and this inequity, and how the vaccines were being administered in the community. And they had social media posts for Facebook already ready to go. You just had to go to their website and click and add them on. But there were either images of white or Black Americans or Hispanic or Latino Americans, and the only translated information was in Spanish. And so when I looked at it, and they were trying to do for 2 weeks, every single day, all these organizations were going to just kind of bombard the community with these social media posts. I could not find anything that really spoke to my community, because the images were not there. The messaging did not come from that religious point of view. And that's understanding my community, that, hey, you stick, a religious message within it, people listen. People are more likely, certain population are more likely to think, think twice about what the message is. So, thinking about that, there's some of the things that we've done over the last almost 2 years now, is make sure that we had imagery or videos on social media with Muslim community members. And videos is one thing. On Facebook, it gets a lot of shares and a lot of likes. I mean, it's amazing. Sometimes you think it's a post, but even a short video, a 5-minute video of somebody recognizes saying something, people will stop and listen to it. And then when the vaccines rolled out, we had several vaccination events at local mosques. And so we were very intentional that when we had these vaccine events, we had people hold up signs saying, "I've been vaccinated." And if you can, Megan, share the slide that I have. So we were at these vaccine events that we helped put together. Thank you. And then we had this, just a simple poster board. "I got vaccinated. Are you ready?" And so people could see that people like them was getting vaccinated. This wasn't another person's issue. This was our issue. This was an issue within the Muslim community. And we're kind of trying to create that peer pressure. Everyone else is doing it. Why aren't you doing it? And so kind of that kind of messaging. And also in this slide, the vaccines rolled out. These vaccine clinics were last in the April 2021, and that was right before the holy month of Ramadan. So where Muslims fast every day for a month. And so again, that messaging, thinking about in 2020 during the month of Ramadan, and in the month of Ramadan, it's a celebration. Everyone's fasting. They come together. They break the fast together with family, friends. They go to the mosque. They extra pray. It's a very communal event. But in 2020, all the mosques were closed, and people were doing it in isolation at home, just with their immediate families. So this was a chance to kind of come out of the pandemic. Things got better, and so again. Kind of asking the people the question, don't you want to have that same Ramadan that you used to love, where you're with community and but you're still safe? And so that's the idea about kind of using that religious messaging, using, for us it was Ramadan, but whether it's a holiday or any other special occasion, kind of pairing that up, and how can you remind people that vaccinations can make that even safer. So that's kind of the campaign we had going during Ramadan to try to get people vaccinated. At those events, one of our local imams or clergy, he got vaccinated, and he actually he was like, take pictures of me, take video of me. And so he posted it on his social media, pictures of him getting vaccinated, and it got a lot of shares. So he was the example of the influencer. He was a local imam, lived here a long time. He was well known in the Somali community. He had been the imam in 2 different mosques, and one of them was the largest mosque here in Nashville. So a lot of people knew him, and so it was very, he could influence a lot of people, and so I thought that was very important to have him do it. So with all these posts, I think simplicity is the key. And I love what Dana said, like, you don't want to do too much write up with a post. The picture should speak for itself, especially we know in our community with Facebook, nobody's going to read a whole long post. It's like quickly seeing it over and over again. And then the messaging has to be tailored to your audience. Again, I see a lot of things on the internet, things from different, foundations or whatnot on social media posts that I can just, share those also. But I feel like as a small organization, if I post too many things that aren't tailored to my community specifically, people are going to ignore it. And so I think it's important to be very, to tailor your message and not just post all the time and just anything. It should reflect your messaging, your post should reflect your community. And then leveraging the trusted leaders here, like even in this picture, the person on the top left, he's the board member of a local mosque. The person in the bottom right is imam and board member of a mosque, and so again, that goes a long way. So that's my story. I hope I can incorporate some of Dana's suggestions, but there you have it.
Thank you so much, Sabina. I think you really highlight the importance of representation and making sure that in all our efforts, you're seeing yourself reflected in the work that we're doing. So I really appreciate you taking the time to highlight that. We're going to turn it over to Dr. Gilberto Lopez. And in the meantime, all the presenters, please start answering the questions in the chat and in the Q&A, because it is lighting up with great questions, great chatting going on, and I know time is a ticking. So if you will do that, we will turn it over to Gil. Take it away.
Hi, everybody. Are my slides up? So my name is Gilberto Lopez. I'm an assistant professor here at Arizona State University School of Transborder Studies. I'll be talking a little bit about the COVID Latino campaign or health communication campaign that I'm a director of and that we launched about a year and a half ago that we started this project. And I'll talk a little bit how the work that we've been doing. But first, next slide. First, I want to give this a little bit of context. So these are, sadly, these data are outdated now. COVID-19 has been the one event where most death has happened in the US. When we think of death at a mass scale, we think wars, pandemics, and increasingly so, weather events. They're becoming, causes of large death, numbers of death in one event. And COVID is now at 800 something, I believe, here in the US, which is more than all of these wars here put together. So it is exceptional times that we're living through. And I keep saying 100 years from now, when we look back at this, we're going to see how big of an issue this was and how it affected many different communities. Next slide. And the story here is that although it is the number one cause, the largest cause of death in recent times, that is not equally distributed across communities, across populations in the US. Here's some data that on average, the US, people in the US lost 1.5 years of life. They're on average living 1.5 years less due to COVID. That's different for Hispanic Latino men who lost almost 4 years of life, of average of life because of COVID. So there's these inequities. Certain populations are higher risk, and there's different reasons why. You know, we look at social determinants of health, the context and the history behind who lives where do they work, and how does that put them at risk, has disproportionately affected minoritized communities, including Hispanic, Latino, Latinx communities. Next slide, please. And one of these determinants is information. We've been talking about this. Where is information coming from? Where is our community getting information? This came out late last year, and it was from a report from the Nielsen organization, and finding that Latinos are more likely to consume and share misinformation online. A lot of these platforms that have been discussed, WhatsApp being one of them. You know, WhatsApp is one of the platforms that the Latino community, especially the immigrant communities, depend on to exchange information, especially, you know, recent times, the quote unquote caravans that are coming through Mexico. WhatsApp has been a platform where a lot of information of, you know, where to get food, where to get, you know, housing on your way there, where to get care, who to look out for, where are the dangers. So these are platforms that are very essential and important for information. So next slide. So what we did, we launched the COVID Latino Project. We collected data. We started doing interviews and surveys in California, Central Valley, and across Arizona. So this was with the Latinx communities here in the Central Valley in California to understand beliefs, attitudes, and perceptions. I won't go much into the data here. You know, it's too short a presentation, but everything I'm going to show you from now on is informed by the data we collected, but also data coming out and other stories coming out about the Latino community and the relationship with vaccines and ideas and behaviors around vaccination. Next slide. So what we did, again, we launched the COVID Latino campaign, and what this is, it officially launched in April of last year. What it is we creating a series of animations and still arts and cartoons. This is all to bring needlessly complex information, this information that's out there about COVID, about vaccines, to make it accessible to the community whose behavior we're trying to change, or who we're trying to convince and encourage to get vaccinated or use protection against COVID. So that's what we're doing. We're combining the arts with the social sciences, the health sciences, and the medical sciences. So we create a team that consists of researchers, student, community leaders, and community organizations, which are essential. There is a comment on here about promotoras de salud. Promotoras de salud and other community, you know, health workers. They've been, you know, the driving force behind a lot of this messaging. And without their work, I mean, it's impossible to move health equity without this true collaboration with community and allowing them to have an equal voice at the table. So what I'm going to do, I'm going to show you two animations. They're short 1-minute animations, so you could understand what I'm talking about. Then I'll go into the theory and how we came about these.
They are going to chip you with the vaccine. They will follow you. They will track everything you do. Look, I'm so upset about this. My temperature is 102 degrees.
Oh, te rigo. There are no chips in the vaccine. Stop spreading false information on social media. If our community doesn't take the vaccine, then the virus will bounce from body to body, creating new mutations, which may become resistant to the vaccines. That's why everybody needs to take the vaccine. It trains your immune system to fight the virus. The vaccine contains something that looks like part of the virus, but is not the virus itself. Our bodies learn to recognize it and learn how to fight it. This helps our body make something called antibodies that can attack and kill the real virus before it starts to spread. So make sure you go and get vaccinated.
Regal.
The doctor is right. Stop spreading nonsense. Nobody wants to track you. And if they did, you put everything on the internet already. Put the thing away and come have some frijolitos con nopales.
So I'm going to show one more to answer some of these questions. To answer quickly with some of these questions, yes, these are all in Spanish, English. We have them in Zapoteco, which is an indigenous language from Mexico, which is a large immigrant group. We're working on getting it in Mixteco, and we're trying to get them in Mayan languages. So there's many languages that we're trying to do these, but for the most part, for now, they're English, Spanish, and Zapoteco. This one here is in Spanish. So we'll show this one, then I'll come back and talk about it.
Les habla su capitán, soy la Buen Rostro. Gracias por volar con nosotros. Estaremos despegando en unos momentos.
Algunos aspectos a tener en cuenta mientras se abrochan los cinturones de seguridad. Aunque la gente ha reanudado los viajes, todavía tenemos que ser cautelosos, especialmente a nivel internacional. Sobrevolaremos países en los que las tasas de COVID todavía son altas y las tasas de vacunación siguen siendo bajas. Es importante, por amor a nuestros familiares, evitar los viajes en la medida de lo posible. Pero si tienes que hacerlo, asegúrate de vacunarte. Y recuerde que, aunque esté vacunado, puede poner en riesgo a las personas al celebrar grandes reuniones. Así que hazlo simple, hazlo pequeño. ¿Quieres asegurarte de que todo el mundo esté allí para la próxima reunión?
So we create these animations
Les
based on different data points that we had. So if you see here the themes that are emerging, the first one talks about there was this fear, specifically men, and not just Latino men across the world, even women, but men for the most part, were afraid to get the vaccine because there's a chip in the vaccine that you're going to get tracked with, or the government's trying to get you. These fears are rational. They're not as irrational as we think they are, because just look at the history of many countries, including ours. There is a history of trying to get certain people out of the country, and there is history of trying to track individuals. So the fears themselves is something we're not trying to judge, but we're trying to understand, where does this fear come from, and then work with those ideas to propose and bring information that is scientifically or medically informed. That's the first one. The second one came out when, especially in the Latino community, you had a lot of people flying back to their countries. And the risk is that, we're the most infected country in the world. We're bringing the disease to them. That's how it's perceived. So we're trying to raise awareness of, yes, please know that not everybody has access to vaccines like we do in this country. Even though there's inequities in who gets access within the US, globally speaking, we have a lot of access to these vaccines compared to other countries. And a lot of these are Latin American countries. So be mindful of it, protect the family you're gonna go visit. If you can, don't go, but if you have to go, use these best practices. So these are the messages. Quickly, before I forget this, there's questions about accessing these. All of these animations that we created, they're free. They're free, they're made, they're designed to be shared. You could go to our website. Our website is not that great. We're a small shop when it comes to the website and all that, but our social media platforms have these. We have a YouTube channel. You could use those. If you wanted to get the links yourself and download them, contact me, and then I'll gladly connect you with the link to actually download them and have them as MP4s. So really briefly, just to end here, can we go back one slide? I'll finish in a minute. So the other thing we did was infographics. This is what came out from the NIH or CDC, yeah, NIH. This is the standard infographic you see in a clinic. So what we did is, how do we make this more culturally attuned and culturally tailored. So what we created is, this next slide, please. We created these loteria cards. So it's the same information, next slide. It's the same information, but with more of a cultural iconography that we're using. And the rationale here is, if you're walking out of a clinic, out of a market, supermarket, a corner store, if you see this, it's gonna make you look twice. You might not read it. Most people probably won't read it, but you'll look twice because this looks familiar. The other one is your standard, every clinic has some sort of infographic like that. So we created these, we have a series of these. Next slide. And then we also collaborate with artists to use cultural iconography and characters. Virgen de Guadalupe, Vicente Fernandez on a horse. Next slide. And then we also have historical figures, La Delitas from the Mexican Revolution. You have warriors from pre-colonial times. Again, to kind of appeal to that cultural relevancy that, and sense of identity that people have to get the message. Next, please. And I think this is the last one here. We also collaborate with artists, Lalo Alcaraz, who worked on Coco. He's got a show on Fox, cartoons on Fox. So we worked with a series of these cartoons. So every week he was creating one on different themes. One here on the right, farm workers. We wanted to get this, we depend, one thing I guess we could be proud of as a country is our food supply was never really stopped. We had shortages of certain things, but in general, we had food to eat, thanks to literally the backs of those working, essential jobs, including agriculture. So that's what that animation. The one on the left, this one came out when governments, when state and county governments were raffling away cars, millions of dollars. And the message here is, you might not win the $1 million, but there's other things you could win with the vaccination. And again, this is kind of return to normal kind of image. Again, using iconography from the Mexican Loteria game. So I think I'm out of time here. I'll end again, to answer the question that was asked, how do I get these? All of these, you could share them, you could use them. You just can't modify any of them, but they're all there for the communities to use. And if you have any question on using them, here's my email, contact me, and we could work something out. If you need us to modify anything, we'll be happy to, put your logos if you need to do that. The California Department of Public Health started using our animations. So that's what they're for, again, for the community to see. Thank you very much.
Thank you so much, Dr. Lopez. I'm going to invite all our panelists to come back on screen here. We have almost run out of time. I'm going to pose one question here because it's one that comes up a great deal. And if all of you could just give us your kind of closing remarks in the context of how you might address this question, it'll probably come as no surprise that we've gotten a lot of questions about how to deal with misinformation, how to deal with the trolls out there, how to deal with hate comments that are posted against your organizations or on some of the things you post. So in just closing here in a sentence or two, can you give us that last little juicy bit of advice for our CBOs out there about how best to deal with this issue? And I'm going to ask you, Dana, to kick it off.
Yeah, sure. And as we have some folks have been mentioning in the comments, I think it's very different depending on, if you're just a community nonprofit that started yourself and you can sort of delete every post that comes your way, or if you're a university or government organization and there are rules for not, you can't hide or block anyone, freedom of speech. So we want to first and foremost pay attention to those rules. But secondly, I think the key with disinformation is, never repeating it and never sort of, using the myth again in the busting of the myth. And we also know that when we do engage with folks who are sort of saying misinformation, that, the algorithm is then seeing that as engagement and pushing it up. So it is sort of a catch-22. I think being really mindful of what channels you're on, and so that you're not trying to manage a Facebook page with comments coming in, and then also a Twitter, and then also a blog. Maybe if you're getting like really bad responses on your Facebook video ads, like try them on YouTube. And as somebody suggested, YouTube has a great feature where your comments go after you approve them, or trying it on a channel where where the audience might be different. I think it's a lot of finding, where your base is, and going to them and having that conversation there. And the guidelines can really be a helpful way of sort of setting rules so that you can follow through.
Right. Great. Thank you for that, Dana. We're going to be launching our poll here very shortly because we're so short on time, at the same time that we're asking our final speakers to just wrap up in a sentence or two. So Sabina, can you say in a word or two how you deal with mis and disinformation and the trolls out there who might be posting negative comments on your posts?
Well, with the misinformation, I think we don't get a lot of comments on that, honestly, on social media. But we know people are sharing that misinformation especially on WhatsApp groups, and then that goes back to the educational piece and equipping those trusted messengers with whether it's social media posts, graphics that they can quickly put into those WhatsApp group to counter those messages.
Great, thank you, and thank you so much for the work you're doing in Tennessee. Gil, last couple words.
Just that culturally tailoring is important. The status quo is not working, and it's not been working for our communities. So we need to change the discourse. We need to change how we do messaging, because the way they've been done does not work, has not worked. So culturally tailoring, I think it's essential that we understand the community and use their language.
Thank you so much. I really have learned so much this afternoon. Thank you to our presenters. You've all been amazing and awesome. Want to give a shout out to our partners at Health Leads for their support in putting on this webinar. A reminder that we're going to send out the recording and the slides to everyone who is registered. And then as we close out and wrap up for today, I really want to acknowledge the work of all the community-based organizations across the country who are helping us reach vulnerable populations and communities. You know best, you know how to do it, and we're here to support you in the work you're doing to end the COVID-19 pandemic. So we love hearing from you, and we will definitely following up. Stay tuned for more information. And thank you again for your participation here today.